All right, welcome. I hope you're all well. You may have seen in the news the article we talked about. You may have. That was hot off the press. Hot off the press, as we say. One of the statements in there was, the egocentric, self-referential processing that occurs, and we're actually attenuating that. Right? Um, Anytime we attenuate something, right? We take a lot of medications to attenuate things. We take a lot of medications to attenuate neuronal firing. Um, Sometimes what happens is that based on our upbringings, based on genetics, based on whatever may be, uh, a lot of based on our thoughts and emotions, we're firing. Our neurons in these particular areas are firing. That are these areas, in the default mode network, in the anterior cingulate cortex, in the prefrontal cortex, all these different parts of the brain. Doesn't really matter. But what does matter is what their primary function is. And a lot of what you're talking about is that egocentric, self-referential, creating of meaning with respect to pain, whether that's physical, emotional, spiritual, whatever that is. And then how that self-referential thought pattern then triggers other pathways that then create an entire story that we're all living in. And oftentimes when we create these sorts of stories that we live in, we're masking reality. We're masking other senses. We're not fully open to the senses that are present. Talking about more subtle senses, even on the ethereal or the energetic plane, that, for instance, a blueprint or something energetically may appear prior to the physical, and that some people can notice that. Just like practicing interoception or different ways of sensing, that you can actually learn how to feel more, even from the perspective of our tactile perception. Right? Well, if I can do a practice that teaches me how to feel more subtle shapes and objects and stuff with my fingers, and then what are the other senses that I'm actually trying to develop interoceptively, internally, right? To have these, to be open to more information that's actually coming from the universe, and processing it, right? But it is quite incredible. There are some major points in this that we can come back to, because sometimes it is beyond sort of like it's like, wow, like I don't have a neuroscience degree or something like that, but you don't need a neuroscience degree. And hopefully we can explain it in different ways, that trying to use language that is understandable from many different perspectives. But when a pain signal comes into the brain, it gets processed by a lot of different areas of the brain, and that processing then creates an experience, and that experience is then, you define that as pain. This is what I'm feeling right now. And oftentimes it is the pain, but it's also all the other self-referential negative affective traits of the pain as well, which include fear, anxiety, depression, catastrophizing, all those sorts of things that are associated with the sensation of pain. And those then will trigger other areas in the brain, that then will trigger other areas in the brain, that then will make me feel worthless. Right? So I go from somebody who has shoulder pain to somebody who is a nobody. I should just put my head in the dirt, and I don't even belong to. I don't belong here. Ugh. Why? Because I had shoulder pain. It's the self-referential processes that are occurring post feeling the shoulder pain that is driving me into the no one, the I am completely worthless. I just, ugh. life sucks. I'm super scared. I don't want to go anywhere. Right. And I've been there. Okay. And those are those self-referential mechanisms that are at work. And so we understand that, whoa, then we go backwards. It's almost like we could go backwards. We go backwards, you go, boop, 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 boop. Okay, where did this start? Right. And this is why mindfulness is so amazing, because when you practice this for many levels, you can almost be like, where did that begin? And it's like you're going to the source of the thought that triggered, right? That you felt you felt the pain, you felt the sensation of the ache from the shoulder, and then that triggered almost instantaneously, but we can't separate it because we don't have that ability yet. But as you do this practice, you then can separate it. You go, here's the sensation of the achiness coming from my shoulder. And literally, it feels like it's overlapping, but it's not. Literally, it goes to worthlessness. Where the heck did that come from? You just have pain in your shoulder. Right? But that process, right? That process is then one where through mindfulness, you can actually look at that and be, okay, there's the ache in my shoulder. And there's the worthlessness. Wow, look at that. Look how immediate. It almost seems like they're coupled. And that's why we use that word, right? Couple. They're coupled because as soon as as soon as the pain is triggered, the worthlessness comes up. And now you see them one and the same. Now your pain is now, as soon as you feel the pain, you're worthless. And what's the story that you're done telling yourself? Well, I'm worthless. Well, what kind of story do you want to be telling yourself? If you want to be worthless, then continue going down that path. All right. So just in the practice of mindfulness, and this is why that research is so powerful. That nobody's asking you to like change your beliefs. I'm not saying, oh, stop believing you're worthless, right? I'm not telling you that. Stop believing you're worthless. You're like, I can't because the pain is actually triggering that so quickly that it's coupled. So the pain, I am worthless because I have pain. Okay. Stop feeling depressed. I can't. That's the trigger, right? The self-referential. Okay. So with this practice, all you're doing, paying attention to the breath. and the reason why I love this is because this guy is becoming the world expert in mindfulness research. Okay. This is the premier expert in mindfulness research, I guarantee you. The method that he's using to do research is saying, pay attention to the breath. Pay attention to the sensations of the breath. Have a non-evaluative disregard for other thoughts and emotions and sensations that arise. If your mind wanders, which we know it does, come back to your breath non-judgmentally. And that's it, right? So we're doing some of the most hardcore science in mindfulness research, and that's the instruction that he gives his patients. And with that, right, after only 4 sessions of 20 minutes, you already start seeing these changes in the brain. This is self-induced neurosurgery. Right, you're already changing the way that the thalamus is actually connecting with your higher ordered cortex, as opposed to taking a needle and sticking into it and saying, you know what, turn up the electricity and give me electroconvulsive therapy here, because that's the same thing it's doing. You're taking a needle, you're sticking it, and you're saying, I need to activate this part, or I want to suppress this part. You're actually doing this with your own paying attention to your breath. You're attenuating and changing these signals internally, consciously. Right? Now, the coolest part, right, comes from when I give somebody gabapentin or Lyrica or Topamax or topiramate or opioids for that matter. Okay. Gabapentin was originally called Neurontin when it came out. I was in medical school when they were studying it. It was studied for seizures, epilepsy. All right. That was the primary indication for seizures and epilepsy. Okay. It didn't perform so well. It was okay, but it didn't perform so well. But the side effects of the medication were some people who had neuropathic pain, which is that pain that's like burning, diabetic neuropathy, sort of burning numbness. You feel like you're always on like pins and needles, right? The side effect that they were reporting was they had decreased neuropathic pain. So then it became the medication for neuropathic pain, but it was a seizure medication, right? Neurontin, Lyrica. They are in the class of medications are called anti-epileptic, anti-convulsant medications, right? Epilepsy, right, is an uncontrolled firing of neurons that then trigger you to to have uncontrolled movements or whatever the epileptic seizure is, right? So what do I give you? I give you an anti-epileptic. What does that do? It attenuates neuronal firing. If I can attenuate neuronal firing in somebody with epilepsy, right, then I give you that medication and then we try to control that focus, the seizures. Okay. What was the finding that they said from mindfulness meditation that this does? Attenuates neuronal firing. Right. So you're doing this without medication. Amazing. Right. Now what they found is the thalamus, right? And this is probably one of the coolest things because, our conscious understanding of the thalamus is expanding. How much control do we have of the thalamus in terms of consciously asking it, right? Have you ever had a conversation with your thalamus? I'm serious. Start to have a conversation with your thalamus. Start to have a relationship with your thalamus. I'm not kidding. All right. Say, thalamus, how are you doing today? Well, I'm doing all right. Why are you asking? Well, you know what? I want to have a little relationship with you. How about let's try it? All right. Let's try it. Can we learn how to consciously filter signals that are coming through the thalamus and being sent to like my other brain areas that are processing it and spitting out an experience? And the thalamus will respond, yes. I do this all the time for you. Okay. And I've used certain examples like this. All right. If you have a neon light or some sort of fluorescent light above your head, right, and it's buzzing, you've filtered that out. That's the thalamus taking that information and filtering that. Right? If you live by a train track, for instance, and the train goes by and then somebody visits you, okay, do they say, "Oh my goodness, what is that?" And you're like, "What is what?" And they're like, "What, that sound? It seems like there's a train going." "Oh yeah, that sound. I didn't even hear it. That's the train." We live by a train track. It's like 3 doors down. All right. Your thalamus is actually doing this all the time for you. Okay. If there's a low kind of buzz sound in your room when you're sleeping at night and all of a sudden it disappears, your thalamus is taking that information and filtering it and not letting your higher cortex experience it. Okay. What they found in these studies in people with pain, and is it going to apply only to pain? No, it's not. Of course it's not. Right? But they've studied people who have pain. The signal from whatever pain, whatever body part is going to the thalamus, it has to go to the thalamus. That's the way that we are wired. All right. So that's the hardware. Okay. It's going to the thalamus, and then from the thalamus, it gets spit to the rest of the cortex. It gets spit to the other areas of the brain, and then you create your experience. Okay. If there is an attenuation of the signal from the thalamus to the higher cortex, you're going to get less of that signal getting up to your brain. That's what opioids do. That's what gabapentin does. That's what pregabalin does. That's what all these anti-seizure, anti-epileptic medications do. Okay. If you go and get a tooth filled, you inject lidocaine. The lidocaine blocks the nerve from sending the signal to the thalamus in the first place. So if that signal never gets to the thalamus, or the thalamus doesn't send that signal up to the brain, guess what? After I get my tooth, I can hit myself with my fist and I don't feel it. Okay, so that's why that finding is such a beautiful finding in people with pain, because what we're doing is, through the practice, we're actually changing the signal that's coming into the thalamus that's then being propagated on. Okay, and now your brain doesn't get the signal. It's like, all right, so what are we doing today? Should we go to the movie? Because I'm not getting that signal. All right, and we can actually do this after 4 sessions of 20 minutes of mindfulness. That this is happening in real time, that we are getting this uncoupling of the thalamus from the cortex and an attenuation of these signals, right? That's number one. That's only one part of it, though. Then we're getting this decrease of activation in those self-referential, egotistic, negative, self-affective processing in the brain. So now you're not going into doom and gloom anymore. Now you're going into, that burning. I definitely feel that burning. All right, well, it is what it is. Man, that really sucks. I used to go into the doom and gloom. Isn't that interesting? Oh, I kind of noticed myself going there right now. Wow, look at that. The path is still there. Despite all the practice I've done, the path is still there. There's still that little vestige of path because it was so strong. It's been so strong for those 10, 15 years that I was in pain. That vestige of it, wow, that path is still there. Amazing. All right. Well, you know what? I'm going to go back to my breath. I'm not going to say the path is wrong. I'm not going to say that it shouldn't be there. I'm not going to say that I suck because the path is still there, that I'm horrible, that I'm worthless, that all my practice did absolutely nothing. No, I'm just simply going to go back to the breath. Am I going to notice all those other judgments? Absolutely. Man, they're there. Okay. And so that's what's so beautiful about this, is that now it's sort of like it's like we're actually able to see the different areas of the brain that are activated when we simply practice mindfulness of the breath, and that there's this uncoupling from the thalamus to the cortex, that there's this filtering, that there seems like in the practice of mindfulness that there's actually this filtering mechanism that's starting to happen with the thalamus, starting to say, hey, you know what? I'm just not going to send this signal as much. And we get this attenuation, or this decrease in the firing of those self-referential stories, egotistic, negative affect, circle that we can spin out of. So not only are you getting the signal that's being decreased to the cortex, which is changing your experience, we're now getting the self-referential part that's being decreased as well. Now we don't have to tell, now there's no story around it. Now you're not a horrible human being because you got into that accident and now you still have neck pain, et cetera, et cetera. Okay. And we're not asking you to change anything. Not asking you to change to say, just stop thinking that you're worthless. Stop being depressed. Just bring your attention to your breath. That will it happen? I don't know. But the research shows that it will likely happen. But that's not what we're focusing on. That's not our focus. Right? Our focus is the breath in this moment non-judgmentally. That's it. Okay. 20 minutes, 4 times, right? For the rest of the day, go ahead, do whatever you want. All right. Okay. That's the power of it, right? 4 times for 20 minutes. And then anybody who's been practicing this for longer knows that it continues to build. Right? That there's like a quantum effect. It's like a snowball effect that happens. You might not notice anything at the beginning, and all of a sudden it's like boom, whoa. Right. So that's the beauty of it. And what I like about it, obviously, is if you've heard me talk before, is I'm really fond of the breath. So using for him to use the breath and to come back to the breath, it's sort of like the most basic of one of the most basic mindfulness practices. But like he said, he didn't ask people to change the rhythm of the breath, right? So a lot of the things that we've discussed in terms of slowing down the breath, extending the exhale, taking deeper breaths, using belly breathing or diaphragmatic breathing, now you're integrating even different parts of the autonomic nervous system into that, right? So now you're not only focusing on the breath, but now you're actually, with the knowledge that we have of what modulating the breath can do to our nervous system, now we're like, wow, not only am I uncoupling the thalamus from the cortex and decreasing these self-referential egotistic thoughts,
Yes.
but I'm also now modulating my autonomic nervous system as well with slowing the breath down, with taking deeper breaths, with extending the exhale. All right. Let's go into our practice today. Okay, so let's find a comfortable posture. A posture we feel relaxed yet alert. Closing your eyes if you feel comfortable closing your eyes. If not, having a soft downward gaze as we're gazing off on the horizon, a setting sun, the moon rising. And just intentionally giving yourself permission to be here now, to do this practice in this moment. And taking 2 or 3 deep breaths, and as you take those deep breaths, notice where you feel the sensation of your breath the most in your body. It may be in your chest expanding and contracting, maybe in your nose as the air flows through the nostrils, maybe in your belly or the whole body. And then breathing regularly. And for this practice, paying attention to the sensation of your breath as you feel it most in your body. That is your resource. that is your anchor. That is where you direct your attention to over and over and over again. The sensation of the breath, where you feel it most in your body as a sensation. And as your mind wanders, or you notice other sensations or thoughts or emotions coming into your awareness, simply recognizing them, no judgment, letting them be, and coming back to your breath. Coming back to your breath over and over and over again. And bringing our attention to the breath, on the breath sensations, in a non-evaluative fashion. There's no good or bad. There's no right or wrong. And as you are doing that, you are actively attenuating or decreasing the neural activity and the communication between your thalamus and somatosensory cortex. You're deactivating your prefrontal cortex, supporting the self-referential processing and effective meaning. All the stories we create about ourselves. We are doing this consciously through paying attention to the breath, the sensations of the breath in the body, and as other thoughts and feelings and emotions appear, recognizing and simply coming back to paying attention to the sensations of the breath in this moment, breath after breath, breath after breath, this moment, this moment, this moment. And just noticing where your attention is now. What is your felt sense of your breath in your body? Allowing your awareness to expand to your whole body, breathing each breath. Now taking 2 or 3 deep breaths, really feeling your whole body expand on the inhale and releasing, relaxing on the exhale. Feeling your breath travel through your whole body. Opening your eyes if your eyes were closed. Reorienting yourself to your room and surroundings. Stretching or moving if you need to stretch. Feeling your feet on the floor. And just reflecting on your practice today.